Good morning, ladies and gentlemen. It's Dr. Julian Novoa. Today is February 16th, 2023. I was asked to comment on a post made by Dr. Tofai, who is a specialist in the removal of hernia meshes and a specialist in the management and complications of hernia meshes. And I take my hat off to Dr. Tofai and her group of doctors that are working with the management of hernia meshes and their complications. It is interesting, however, that she made mention of the condition known as mesh illness. And I just wanted to clarify a couple points. We've been talking about the issues with meshes, hernia meshes in particular, for a number of years, but we've tried to categorize that, and a clarification here is that mesh illness is actually a subcategory of the autoinflammatory autoimmune syndrome induced by adjuvants, or ASIA, that has been named by Dr. Schoenfeld from Israel. Now, we've known for a number of years about this particular syndrome, and what I wanted to do is clarify its subcategorization of the actual umbrella syndrome of ASIA and all of its subcategories. So when you're talking about mesh illness, you're talking about a subcategory of ASIA. When you're talking about breast implant illness, that is a subcategory of ASIA. When you're talking about systemic nickel allergy syndrome, a subcategory of ASIA. So when you're talking about problems with meshes, problems with breast implants, problems with Essure permanent sterilization device, problems with the Filshie Clips, problems with vaginal meshes, urethral meshes, problems with artificial implants of the legs and the vertebra. What are we talking about here? We're all talking about the foreign body reactions, which are mimicking autoimmune diseases. And because they're doing this, the trigger, what's causing this to occur, is the actual implant itself. Now, what's most interesting, especially for my friends in Europe and in Australia, New Zealand, for example, is the fact that there are still doctors, well, in the United States too, still doctors that promote the use of artificial mesh as a gold standard of management for hernias. Now, you have to remember that because these meshes, in most cases made of polyester fibers, are artificial devices, artificial material, they will inherently induce a foreign body reaction in anywhere between 10 and 20% of patients, maybe even 30% of patients. And they are inherently, by nature, inherently going to cause foreign body reactions. But not only that, it is very difficult to avoid not getting a contamination of any type of mesh material, even when you're very, very careful. And because there's a contamination of the mesh material, infection may lead to problems by the infection itself. And once you have an infection of a mesh, by the biofilm that's created by the bacteria that contaminates that particular mesh, it may be impossible to get rid of the biofilm contamination of that mesh. Nevertheless, doctors will continuously try to manage you with the mesh still in place. If you have symptoms of pain, if you have symptoms of infection, if you have autoimmune symptoms, these meshes should be removed. But here's the problem. The problem is they're very difficult to remove, and only specialists, like I mentioned before, are able to remove these meshes. It's key to remember that you should not be going through pain and suffering for weeks, months, or years by working with doctors that don't know how to remove mesh. It's so important to find yourself a specialist like Dr. Tofel, to remove these particular meshes as soon as you notice that there's a problem, as soon as you notice that there's an issue with mesh illness, as soon as you know that there's an issue with ASIA. Get the meshes removed and make sure that in the future, as a general point, that doctors are accountable for the fact that they must explain to their patients that mesh illness is a true syndrome. It is a problem inherent to biological meshes, for example, but also a part of the greater ASIA, the condition of ASIA. So if you don't know, the bottom line is this: if you don't know how to remove a mesh, you should never place a mesh. That's the bottom line here. Hopefully, mesh will convert back to the using biological degradable mesh materials or fascia mesh from your own body, fascia from your own body, or cadaver, for example, or something that's biodegradable as compared to non-biodegradable polyester fiber meshes, such as what is most commonly used here in the United States as well as throughout the world. So remember, if someone's describing mesh implant illness, they're actually describing Asia. Thanks so much for watching. Take care.